Okay, so we proceed with the series, and I'm very glad and happy that Professor Andriy from Ukraine is here, and we can discuss challenges in neurotrauma care in the Ukraine now. And Professor Hook is chief of the Department of Endoscopic and Craniofacial Neurosurgery in Kiev, Ukraine, deputy director and consultant neurosurgeon in Kiev, Ukraine of the Romodanov Neurosurgery Institute. He is advisor to Minister of Health of Ukraine. He's director of the representative office in Ukraine, and he is director general of the National Charitable Fund Future Group Ukraine in Kiev. And I think we are all very happy that you have taken time, and I'm looking forward to talking to you now. And so my first question is, as we have the 20th anniversary of the AMN, what are the milestones, in your opinion, that the Academy for Multidisciplinary Traumatology has achieved during the last 20 years?
Thank you very much for inviting me, and I'm very glad to see here a lot of people who are thinking in it's like in my philosophy, as you can to do, please do it, and in case of you cannot do but you can suggest, please suggest, or in case you cannot do and can suggest, just say about that honestly, because a lot of people can help you to do what you cannot do. It's philosophy of the Academy is to coalesce people who are willing to spend her money, spend time, and spend knowledge to improve the quality of life and to improve the accessibility to the care, especially for patients with neurotrauma. So it's a different. If you're talking about the multidisciplinary problem of neurotrauma, we see that we really need to have a team of really inspired people who dedicated and who really would like to improve the situation. And I like what I heard many times from different Congress, that money is not the main point, how to improve the situation. We have to find different ways, take into account now artificial intelligence, also using all kind of devices that we can, all kind of social networks, and to share information. Share information now, it's one of the important part of the work, and really share information that really we can trust. I think it's very important, because sometimes impossible to use some information, but in case of not appropriate information, so we can do some mistakes, but we would like to avoid mistakes as much as we can, especially in neurotrauma. This is my answer.
Okay, thank you very much. And you pinpointed that it's very important to go for large problems or large questions step by step, and to approach for multidisciplinary experts. And I think the AMN is a perfect society with all the connections to other partner societies to provide this. And your approach is also, if I understand correctly, that it's always a team work, and the challenges can be overcome by teamwork, and money is important, but it's not the main burden. It's because very often in neurotrauma, the problem seems to be so huge, and so if we go step by step, we can improve slowly, but very, impressively the patient's care. And I think also particularly the talks during the Congress showed how all the researchers or clinicians started with a small group and expanded over time.
Yeah, correct.
Yeah, okay. So, let's take a look to the Ukraine, to your country, which is with the war in very difficult times. And could you outline a little bit on the neurotrauma care in terms of TBI, but also spinal cord injury? What has changed during the war, and what are the main needs that could help to improve the situation?
Yeah, as you know, we have a big disaster, Russian invasion, starting from 2022 and from February 24, and we have around 12 million people who moved from Ukraine and in Ukraine. So the exact figures we don't know. We have a lot of killed people, a lot of injured, wounded. The blast trauma dramatically increased, but unfortunately we have a problem with data collection now, and we didn't launch TBI register so far. We started this work, but unfortunately because of war. And I think that around 10% of traumatic brain injury now is from wounded people, from both soldiers and civilians. And also we have increase in the number of people who really need psychological assistance, and a lot of people who has who is post-traumatic stress disorders, and also who is depression. So it means that our healthcare system dramatically reorganized, and every civilian hospital now is for both for military and for civilians, and also receiving every day numerous people from the front line. And our Romanov Institute is second line, and we are receiving a lot of people for reconstructive surgery after traumatic brain injury and spinal cord injury. And of course, we have very good trained system of civil and war paramedics or medics who are working using different kind of transportation. So, and again, back to our work with Academy of Multidisciplinary Neurotrauma, we see that have it very important to have very clear guidelines and very clear pathways for patients, especially if you're talking about the pre-hospital stage. We are really doing our best to see how often and how effectively we can use ABC components for early stage of traumatic brain injury, and then how to move to early surgery or conservative treatment and move to early rehabilitation. That we really also use now. We have a majority of our hospitals has the common understanding that patients have to be treated under one roof, because unfortunately, because of war, we cannot refer patients to different hospitals. Unfortunately, not working.
Okay, so you mentioned the implementation of registries were stopped due to the war.
Yeah, because we test, and we continue to do that, but unfortunately now, because of increasing number of patients, especially with blast trauma, so we moving very slowly.
Okay, and but the numbers of blast trauma and usual neurotrauma, are they documented officially?
Yes, of course, okay. Documented officially, but not through the registry. And also we have for the whole country, for every hospital, electronic database system.
Okay.
And it's obligatory for every hospital, but we are now talking to Ministry of Health how to combine this with TBI register.
So you mentioned already the clear pathways which are needed. So how about, or can you please comment on the needs of staff and facilities and...
Another problem. Another problem is that we also we have two people trained thanks to our academy and thanks to possibility to have a training center in Vienna, and a lot of good positive signs that we need also to train our staff and multidisciplinary staff to move more fast in case of TBI, especially when patient already admitted to hospitals that are ready to accept the patient. So of course, in that case also we need to take care of many people who are now medical staff going back and forth to frontline.
Okay.
They have rotation every 3 months like that.
Okay, so it sounds like that it's very, very challenging, and yeah, I think everybody hopes that the situation will be better, and so let's have a look also to the AMN for my final question. So the AMN increased its network immensely during the last 20 years, and now we are setting up new guidelines for neurotrauma in collaboration and together with other partner societies. What priority topics do you think needs to be definitely addressed?
I think that we need to take more our attention on the duration of each stage of guidelines, and to have, from my point of view, I made some estimates that we need to have a clear understanding for every member of the staff who involved in TBI management, who at what stage, what exactly, and at what time have to do. So not only to be completed as soon as it's possible, but also have a time duration for that, because it's very help our managers to work here and control the quality of care. And also I think that early rehabilitation and how it connected, I know that we don't have enough data, but have it connected to the rehabilitation process and quality of life. So we spend more money, we need to spend more money for more research, but to have a really clear understanding what is a better way to preserve secondary damage and to make possible as soon as it can to recover brain. Because I think the problem, especially from our country, I see that it is not traumatic brain injury patient is not alone. He has family, and this trauma affect to society. It's problem not only patient, not only medicine. It's a big problem of society.
I think this is a very important last word from your side, and so I thank you very much. And so we proceed with the next interview, and I think there is a big applause also necessary. And thank you very much.
Thank you so much.